I'm done.
You're waking up with 6 on Your Side News. Good morning, Idaho.
Good morning, everybody. Welcome back to Good Morning, Idaho. I'm Matt Sizemore.
And I'm Jillian Griggs. We continue our Finding Hope series this morning in a mission to help improve accessibility to mental health resources in Idaho and, more importantly, share personal stories to reduce stigma and raise awareness.
In today's Finding Hope, 6 on Your Side's Frankie Catafias explores some of the challenges minorities in the Gem State face when trying to access mental health care.
I think people of color are definitely going through things or going through life a little different than others.
Imagine living in a place where most people don't look like you, maybe don't speak your language, or don't know your culture. For a small percent of Idahoans today, that's exactly how they feel. According to the U.S. Census Bureau, in 2019, Caucasians who did not identify as Hispanic or Latino in Idaho make up more than 81% of the population. That statistic, experts say, can lead to discrimination.
Unless you've really lived those things, it's going to be truly hard to relate to those kinds of experiences. So many people of color have experienced discrimination that you and I can't understand or comprehend.
Racial discrimination is just one of many reasons minorities may be hesitant to seek help for their mental health. Other factors include stigmas attached to their culture.
With the Mexican culture, at least my family, mental health doesn't exist. It took years for me to find one person and even accept that I needed some help with just mental health.
There's a lot of stigma in mental health anyways, and you consider the language, the transportation as barriers, it becomes really challenging.
Here in Idaho, state-funded and operated community-based mental health care services are available. Interpreter services and language assistance is also offered for anyone with limited English-speaking ability. But having available resources isn't the problem. Accessibility is.
I think that the problem stems from not knowing about those resources. As you mentioned, language is a huge barrier. Transportation outside of Ada and Canyon County, it's really rural.
Frankie Catafias, 6 on Your Side.
And for a list of resources available to people of all incomes, ethnicities, and languages, you can head to healthandwelfare.idaho.gov.